All right, it looks like we're leveling off, so I'll go ahead and get this show on the road. Hello and good morning, everyone. Welcome to this presentation of the Direct Care Careers Learning Management System, or LMS overview. My name is John Hendricks, and I am the Direct Care Workforce Support Specialist for the Direct Care Workforce Unit. We'll start today by discussing what Direct Care Careers is and what it offers. Next, we'll review what's new in the LMS, review course modules, then go into a live demonstration where we'll show you how to navigate, enroll in courses, and access resources. After that, we'll take a look at upcoming features before opening up for questions and closing remarks. So please hold any questions until the end, but do feel free to utilize the chat during the presentation, as I have a few colleagues here with me today to help monitor and answer questions there. And if they're not able to answer some of your questions, we'll hold those till the end, and I will answer them in the Q&A session where people can hop off mute and ask verbally as well. Okay, so I wanted to kick this off and just what is Direct Care Careers? So Direct Care Careers is a platform that serves as the central hub for Colorado's direct care workforce. It's free to use for home and community-based service providers, including Consumer Direct Attendant Support Services, or CDOS, Long-Term Home Health, or LTHH, and programs of all-inclusive care for the elderly, or PACE. It supports direct care recruitment, retention, and training. For workers, workers can build resumes and be auto-matched with jobs that are already on the website, or vice versa. Employers can post a job resume and be auto-matched with workers who are already on the website. They also have access to skill building training and can explore the resources for both personal and professional development. For employers, employers can post job openings, as mentioned, and connect with qualified candidates or workers and use training modules to support staff development. Anyone who signs up for the site, be it an employer or a worker, will have access to the resource library, can view open positions, and access the LMS and the training modules. So what's new on this LMS? We do have a new calendar that lists training opportunities that's collected from around the state. For those of you familiar with the old LMS, what I used to do was put these into the announcements field on the left side of the website. They would announce these and have the links. Now we have a full calendar where I go in monthly and I add like webinars from across the state and nationwide. All of the trainings that I find are free, so no paid courses are ever posted. So this allows employers and workers to find live and upcoming sessions that support their professional development, and also things like burnout or mental health for first aid, anything like that. I find that are upcoming, I'll throw on that calendar. It also has a personal dashboard. So prior to this, you kind of had to, this new LMS, a worker would have to really track all of the modules that they completed and keep track of all of the certificates they were issued. So now we have a dashboard that shows all of the courses that are in progress, which modules have been completed, and which have earned certificates. Users can actually share these certificates directly with employers and mark off the completed activities. And that's something new as well with certificates. It was kind of on the old LMS, you could go in, you could look at it, you could download it, and it would show on your profile page, but you couldn't really send it anywhere. So now we have the options, and I'll get into it in the live demonstration about how to access your certificates and share them online. All right, and now we're going to want to just kind of have an overview of the Learning Center modules, and I'm going to hand it over to Heather, and Heather is going to go through the modules. I'll be dropping some links to demo videos we created for each section. Now, these links are of the old LMS, so we are working on getting the recordings of these updated to the new LMS, but for the time being, they'll still get you the information that you need. So Heather?
Thank you. Heather Johnson. I'm the long-term direct care workforce unit supervisor here at HICPUF. And just wanting to kind of give folks an idea of the groupings of modules that are available on the um, DCC platform, Direct Care Careers platform. Um, Probably the biggest by far is the Colorado Direct Care training modules. If you recall, it stemmed from the TAC, which was pre-ARPA, pre-COVID. The Training Advisory Committee had identified trainings that would be helpful. And the goal behind that was looking at consistency across care. So the TAC was used to help form the training, and then we were able to leverage our American Rescue Plan Act ARPA funding to help build these out. And the vendor that we used was University of Colorado, Colorado Springs, and they did engage with a lot of various stakeholders. Some of you might be in this meeting with devising this training. So there's 30 modules, there might be 31 for Colorado Direct Care training available on the site. I broke them up here into some categories just to kind of help with frame of reference. Uh, some of it is really just about understanding the direct care role. What is that? What does it mean with HCBS? We are going to revise it now to include CFC, uh, the first choice in there, because that has taken a couple of the broader categories out of HCBS and moved them into just regular Medicaid. So we'll do some retooling of a few, but just for now, this is what we have on there. Introducing into the roles, we have some modules that cover ethics and legal issues. So this is your HIPAA reporting, documentation. We definitely have some in there about safety, privacy, and infection control as well. Really trying to, you'll find person-centered themes throughout. You'll find confidentiality throughout. And then we have some core skills and responsibility modules. And so centering in on a lot of the specific duties as a direct care worker. You can think of this as essentially filling the training requirements for homemaker and personal care worker. And while those are just two aspects of direct care roles, the duties that are wrapped up in those two are really kind of go across the board in a lot of other direct care work. So while they are intended to meet Chapter 26 requirements for homemaker and personal care, they also can be applied more broadly. So we are still working with Colorado Department of Health, Public and CDPHE, Colorado Department of Health, Public Environment. I don't know why I can't say that right. On getting their weigh in on the modules, they have been involved in the process, and we have worked with them a lot. It's a lot for them to review each of the modules to make sure that it meets the requirements. So we have made a crosswalk to really kind of point out what those are. And if you go to the next slide, we'll talk a little bit more about some other modules you can find. Well, let me go back. Still on CDCT, we also have the specialization modules here. So these, while all care should be person-centered care, and our modules really are, it really centered around meeting the members' needs, there are some different groupings of members. And so there are modules that talk very specifically about working with older adults, working with folks with dementia, working with folks who have sensory processing concerns. You can see there's various ones here, working with children. And so these are also ones that can be added depending on the members that the worker is serving. All right, next slide. That might be where I was going. This was another American Rescue Plan Act project that we had, working on foundational skills or soft skills, if you will. These are for folks who maybe are just really new into work in general, or in the direct care healthcare field, to kind of help them understand that balance and resiliency that is needed in these positions. We're often working with members who are having challenging situations, and that can be really hard for a worker to kind of process. Boundaries are really important. We direct care work is often working in a member's home, and you're not working with a team. You're there by yourself. And so we really wanted to find some ways to support individual workers, so they have the skills, they can do that role without so much oversight and supervision. So these are really just to kind of augment that. We have some professionalism and career growth. We love direct care workers. We want them to stay where they're at as long as they want to, but we also have to be uh, considerate of where they might want to go in their life, and the skills that they could take with them are also really important as well. So some some guidance here and some modules about resumes and interviews and just that professional online presence that might be important for folks, depending on where they're at generation wise and what they're used to. And then some more workplace skills, working with different support styles, working with different, you're communicating with teams across the continuum. So just trying to support workers in being adept in all of these areas. And then we have one more module section. Also was a ARPA 1.05. So that was the American Rescue Plan Act, really about career pathways. And so we worked with Arapahoe Community College to build out 5 career modules to show a person where they can leverage their direct care worker knowledge, skills, and abilities into other healthcare jobs. And we try to go with jobs that maybe, that didn't require a whole lot of continuing education for the worker. So just think of it as a next step. We would love to keep direct care workers in the roles as long as possible. And if they can see how they can stay in that role and then leverage those skills into other roles, we think that is a great use of their talents, and it still affects our members in very positive ways. So we have these modules over these topic areas or these positions. So they're fairly interactive, a lot of videos, and they're real life. They worked with real life students and people in these roles at Arapahoe Community College. So we definitely encourage folks to check those out. We would love to be able to add more training modules. The challenge there is time and funding. They're not easy to create and to find the subject matter experts and the funding to be able to create those modules, but we continue to look for ways that we can do that. We partner with other folks within HICPUF on modules that maybe they're putting out for case management agencies or for other providers. Are there ways that we can take those and pare them down to where it makes sense to be on the DCC? And so we welcome people sending us ideas and suggestions. I know we've had a few suggestions come in about cultural competence, and we have a little bit on there. So we are looking into that, like really what are the skills a person needs to be culturally aware and deliver culturally competent care. Another one that has come up a lot is sexuality, especially across the continuum of individuals. Folks with intellectual and developmental disabilities, LGBTQ plus. We're looking for some ways to kind of find some training and some materials that we can bring back and make some direct care worker modules around those. So we welcome ideas and any sort of collaboration. Just know that we have a list going, but we really just have to get time and money to make them actually happen. So um, we are able to, as John mentioned, share out trainings that are available. And so even if it's not a live training and you are aware of training opportunities that are available, we can list them at least as a resource on the Direct Care Careers platform if we don't have access to the SCORM module and to actually have the training module in our LMS, we could still make some references to it. So just putting an open invitation out to share that information with us. And I believe that is all I have regarding the training. And so now we get in the meat. I'll pass it back to John.
Yes, indeed. Thank you, Heather. And I would like just to add to that, as of this morning, we have had 5,516 modules completed on the Direct Care website. And so with that in mind, we are actually seeing about an average of 500 modules completed every month. So great news on that. Thank you again, Heather. Next, we'll continue to the live demonstration of the site. Now we'll be using a demo version of a worker profile. So the demonstration includes logging into the Direct Care website. I will drop a link to the website here in just a second. Here we go. And we'll be reviewing the dashboard layout, navigating the Learning Center, and exploring the calendar and accessing help features. Before we do that, though, I just wanted to let you know that we do have instructional videos. There are a few that I dropped into the chat earlier during Heather's presentation are included, but we also have demos of the resource page, plus a worker user guide and an employer user guide, and a help document library. And that is in this link. So go ahead and check that out if you have any need. And I'll go ahead and stop my share and bring up the demo real quick. Just give me one moment while I switch. Okay. All right. Can you all see the new screen here, the homepage for the direct care careers?
We can, John.
Thank you. Appreciate it. So when you go to just directcarecareers.com or you do an online search, it'll probably take you to this page. So we want to go to Colorado. And while we're here, oh, I'm already signed in. So let me sign out real quick. I apologize on technical issues. I was having some fun in here earlier today. So we'll go back to Colorado. And this is the login page. So the employer sign up, employers, oh, let me go back. That got me a little bit off. I apologize. So for those of you already familiar with Direct Care Careers, the website, some of this is going to be just a nice little refresher. But for those of you who may not have had used the site before, this section will kind of demonstrate how you'll gain access. So for an employer or a provider, they would come to this drop down here, and we would actually need the agency name, the tax ID, email, and zip code. We have a list of pre-approved HCBS employers. So if you're an HCBS employer, you're on that list, but you must be an HCBS employer for the registration to be successful. If the registration fails and you are an HCBS employer, it's often due to a case-sensitive name mismatch or possibly using a comma where we don't have a comma on our side. So to figure that out, you can go up to the healthfirstcolorado.com link and put in your name, and it will come up as we have it. And that solves 99.9% of employer login issues. Similar to that is the CDOS login. So employers who are CDOS employers can register by inputting their name, their FMS ID number. And if you're a CDOS employer, you don't know an FMS ID number, that is just your PALCO or PPL number. So it's the same thing. It's just synonymous with the other. And links are provided to locate these IDs if needed at the top. So you can see the PALCO login and the PPL login to their portals. So if you don't know, that's where you can find those as well. And next we have the sign in for a direct care worker or a potential direct care worker. So these are not pre-approved or vetted in any way. So if you're a direct care worker, or even if you're an individual who is interested in becoming a direct care worker, you can come on here and create a profile and log in. So next, I'm just going to log in. So the login, if you've already have or have already registered, come up there to log in and then hit continue. And this will take you to the main page. And so, as I said, we're going to be using a worker profile. So it's very similar. All of the profiles are very similar. The only difference between the employer and a worker is going to be the amount of tabs at the top, and they have different tabs to upload jobs and things. But for our purposes today, I'm just going to use a worker profile. This is the profile for someone who is a worker. And as you can see, the dashboard displays the user's information and automatically tracks training completion. So when this is training is completed, it will show on the dashboard. On the left-hand menu, that's the main navigation and includes my workspace page, which we're on right now. But also resources. We have over 600 resources available, and that runs the gamut between, sort of like helpful resources for someone in a direct care role in their personal life. So we have childcare resources on there, or links to childcare resources, links to getting or state marketplace for insurance and things like that. But it also has videos from Craig Hospital on how to, safely move someone from a bed to a wheelchair. So it has things to do in their personal lives and their work lives as well. For providers, we have really great resources. I'm putting up like grant resources that I find on there. There's also resources for folks, working with communities and things like that. And then for a CDOS, I have resources on there for how to become a CDOS employer and things of that nature. So over 600 free vetted resources are available. I add resources to that weekly, so it's about 4 to 5 new resources every week. Then we go through and I check it every quarter to make sure there's no broken links and everything's still working right in there. We've also had some really great suggestions from stakeholders. I mentioned Craig Hospital before and transferring from bed to a wheelchair and those videos. That was actually a stakeholder who turned me on to that. So if you're in there and you don't see resources that you feel you use or your workers use in their daily lives, and you know where some of those are, so you can please send those to us. I'll share a link to our email here at the end. And yeah, just please send those in. I'll look at them. And if they look good, I'll go ahead and I'll add them to the resource list. So previous to this, we had a training catalog on the left-hand side, but now you can see that has been removed and we've added the Learning Center. And we've also put this banner down here to just let everyone know that there's a new LMS system and that it's going to look different. It's a little bit different to get to. So I'm going to go ahead and click on the Learning Center and we'll get going with the LMS demo. So this is the new main page. And as we talked about, there's a new kind of workspace to be able to see exactly how many courses you're enrolled in, the courses that you've completed, and the activities you completed. So it's a really good way to be able like, oh, I've completed one, but I have 6 more that I wanted to start and haven't yet. But what I want to do here is go first to the browse all courses. So this is just going to give us an overview of all of the courses. You can search courses by key name. So if you're looking for a HIPAA training, you can put HIPAA in there. I do not use phrases. It really works better with just single words. So put in just a one word that you're looking for, like HIPAA or cleaning or something like that, and that will bring up all of the courses that relate to that. We also have a categories drop down. So if you were looking for career paths, you can go straight to all of those, and it'll bring up all of the career paths we have. I'll go back to all categories because we can also do by the newest or the oldest and also alphabetically, which I'll go to right now. So this shows all of our modules in alphabetical order, all categories. And if you come in here and you see one that you're particularly think that you would want to look at, you can go ahead and hover over the picture and it will bring up more information. So you have the title, you have the start of the a summary and exactly how many people have enrolled when those last updated. So we're going to go ahead and view course. And this is going to bring up the full summary of the course module. So I would be like, oh, yes, this looks like something good. If you want to enroll in it, you can go over here to the enroll now. And then we have to do one more click to completely enroll. And then once we get here, we can actually leave and go to your dashboard and do other things or come back to it later. But if you come back to it, you can come back to view my courses. And so from the view my courses, it's now in my courses. You can see all of the courses that you have in progress. These are courses that you have started but haven't completed. Future, this is something that isn't enabled yet, but we're kind of working on a way to be able to assign modules within the system. So that's something that might be coming in the future. So look out for that. You can look at past, and this will bring up any modules that you have completed. Or you can remove some from view. And to remove any of these, if you clicked on one and you're like, actually, I don't want to do that, you can either click start course or actually remove it and it will take it away. But we don't want to remove it. We want to start the course. So we're going to go in here and hit view course. And then to actually get into the course, you have to click again here on the members and then enter. It gives you your brief overview, and this is now into the training module. So this is pretty much exactly the same as it was on the previous LMS from this point on, but we'll go ahead and look at this just real quick so you get an idea. So we have our main page here with the summary of the course, and if we hit start, we go into it, and there we are. Next, I'm not going to go through the whole course, of course, that would take a little bit too much of our time today. But if you were trying to get into a course and it wouldn't let you, or you've completed a course and you're not seeing your certificate, you can come into the frequently asked questions. And this has information on troubleshooting for courses and enrollment, for course completion, for course certificates, and for technical support. So for technical support, we have a help desk that you can send your information to. The help desk link is also down here at the bottom. And once you send that in, they will get back to you with helpful tips on getting that done. And if it's something that they are not able to figure out, that'll be sent to me, and I'll be able to connect with you. And I usually do like a video chat, and so we'll kind of go through and troubleshoot what's going on. Next, I want to go back to my dashboard. The last section up here, the last button, is to go back to the DCC. So if you clicked on that, you'll be taken back to the main profile page of the DCC. We're not going to do that right now. But what I do want to show you is certificates. So if you click on the drop down on the top right with your initials on it, you can go and view your profile. This is just general profile information, your name, your email address, and things like that. But we want to go down to certificates. So if you click on that, it'll come up with a list of all the certificates you earned. As you saw on the dashboard, we've only earned one. So if you come in here and click on the download button next to the course certificate, it will bring up your certificate. From here, you can, if you're a paper person and you want all these on paper, you want to put them in your file box, you can come up here to the top right and print these out. You can also save it to your computer. So if you wanted to share it out from your computer, you could do that from that button as well. We also have QR codes on the bottom right. So if you wanted to text this to someone or email from your phone, you can open your photo app, wait till it comes up with the link, hit the link, and your certificate will come up on your phone just like it is here. And then you have the options to send it out. You can also send those if like an employer wants to see your certificate, you can send that to them as well. Certificates are also automatically emailed to you. So you should have every certificate for every module that you completed in your email. If you don't, this is just an easy way to go back and find those. I forgot to ask, are you seeing the certificate, or do I need to?
No, we are, John. Yep.
Oh, you are. Okay, perfect.
Yes.
Well, I'll go back. Thank you for that. And we'll go back to this drop down here. And then we're going to get to the calendar feature. So this is a brand new feature that we have here. So this is what I alluded to earlier, what I'm doing is I'm collecting, looking for webinars and things that relate to direct care work. We also have internal HICPUF meetings on here that relate, like participant directed meetings and things like that. So if you came up to one of these, what you can do is just click on a link or a calendar date, and you'll see the name of the webinar, a description about it, and then the link to the webinar at the bottom. So if you're someone and you're feeling a little burned out, you can come here to find that webinar. We also have the care management web series training for introspective for care navigation. We also have some for a trauma response workshop. I look at the Alzheimer's Association website every month, and they always have really great webinars and things like that. So we don't have these out too far. It's only usually just month by month, because webinars typically aren't scheduled out that far. But if I find some, like this case management webinar training series, this is from Rocky Mountain and their care coordination services. I'll throw those on there each month, but it's usually the last to second last week. So it's coming up here when I'm going to load November up with a lot of new trainings. So that's where you can find those and have links straight to um, those as well. One new thing that we're going to be doing that's pretty exciting is we are going to start using badges on the system. So badges are basically a series of modules that you've completed. So we're going to be working with a stakeholder group coming up in the next couple of weeks to sort of identify what categories some of these modules that we have fall into. So we could say that it's like an example I've been using is the homemaker badge. So we'll have if a direct care worker comes through and they complete that series of modules, they will get a badge for like homemaker or whatever categories the group comes up with. And that will be actually put onto the worker's profile page. So if you are an employer and you're looking for a direct care worker, and you see someone's resume, you click on their profile, you'll be able to very easily see what skills they have developed on the website very easily, instead of having to go through kind of piecemeal and look at each completed module. We do have translation features on the site that allows users to translate the module pages. So after completing a page, though, it reverts back to English. And so at each page, the person would have to reselect their preferred language, which isn't great. We don't want people who have a different preferred language to have to go through extra steps. So that is one of the things we're working on right now is to make sure that we have these modules in different languages. So that's going to be another upcoming feature. I'm going to stop my share and get back to our demonstration. Our slideshow here. And so what's next? So the next steps is that we encourage all of you to log in if you haven't already registered, to go register for the site and check it out. See if this is something that's going to work for you. Give us feedback on it as well, for things that you are looking for. As Heather had stated, we want to add new modules. So if you have ideas for modules that would be good for your work or your agency, send those our way. We'll also be looking at um, resources. Again, if you see resources that need to be on there, please feel free to send those to us. And again, the badging system and translation features that we're expecting to work out in the next few months. The badging system we're very excited about, and we're going to be launching that here by the end of the year or early next year. As I said, we are going to start working on that with a small group of folks to whittle those modules down into categories and those categories into badges. So, and then we're going to, and if you don't know what badges are, or what they look like, they're just kind of like little stickers, and it'll just kind of have the name of the categories that you've completed on there, and we'll put those up as soon as we are able to. And at this point, if there are any questions, if you have any feedback, feel free. If there are any questions in chat, Brooke, it might help me out with that and read those out to me. Otherwise, if you have questions, please go ahead, raise your hand, and we'll get to you.
Yeah, John, actually, Laura just posted a question in the chat for us. Are there any plans to develop a series of trainings that would meet the child youth mentorship training requirements for the CHIRP waiver?
Thank you for that question, Laura. Yeah, as Heather said, we don't have any plans particularly right now for any new modules, but in the future, that would be a really great thing to send to us, and we'll log it right now since you asked that question, and put that sort of in the hopper for future modules when we're able to get new modules created.
Perfect. Thanks, John.
Megan asks, can an employer assign trainings to an employee through the portal?
That's a great question, Megan. Thank you for that. So when I was talking about that feature button, when we were looking at the modules, that is what I was alluding to. So right now we are working on a way for with the vendor for employees or workers to be able to associate themselves with an employer, and then for that employer to be able to assign modules to a worker. It's not a functionality we have right now, but all of our conversations with the vendor have been very positive, so I'm optimistic that that's going to be able to happen.
Great, thanks, John.
Yeah. Any other
That's all we have
questions?
right now. Yeah.
Yeah, if you don't have to put them in mute, you can come off, or in the chat, you can come off mute and just ask questions at this point. Fairly loose at this point. Feel free. Any other questions, comments?
John, could you speak a little bit
Yeah.
about the maybe the knowledge checks, the assessment, and like the length of modules? Just a little bit of an overview of that process.
Sure. Thank you, Heather. So the length of modules, for the most part, like all the CDCTs or Colorado Direct Care trainings, those are typically about 30 minutes to complete. The foundational skills, some of them are a little bit longer, so they vary between a half hour and an hour. And the career paths are all pretty much an hour till completion. And thank you for the reminder on the knowledge checks. So all of the Colorado Direct Care training and the foundational skills all have knowledge checks. They're kind of presented in throughout the module as you go. A lot of the Colorado Direct Care trainings have like 7 to 10 questions at the end for a quiz. And so workers actually have to pass those quizzes and those knowledge checks as they go along. So it's not as though I took this, I went through, I read the module, I went to the links, and now I've done it and I get a certificate. Folks have to get a minimum of 80% completion or of the answers correct to be able to close that module out and to receive a certificate. Thanks for that question, Heather.
John, Jenny asks, if a manager is signed in as a provider, can they take courses? If they wanted to get a certificate with their name, would you recommend they create a worker account? Two questions there.
Yeah, no, if you are a provider and you go in and usually that's going to be under the agency name if you're doing it under for your agency. But you can, as an agency, go in and under an agency profile, I should say, go in and take the trainings and the modules. Everything that a worker can do, you would be able to do, except create resumes and things like that. You on your side, you would be able to create those job postings, but everything else is pretty much mirrored exactly the same. So you can do that. But if you wanted it to have your name on that, then yes, you would need to create a worker profile and go in and complete those that way. Thank you for that question.
Yeah, thanks, John. Sadiq asks, I tried to sign up, but it gives me the information entered does not match our records. Please check for errors. How do I verify I'm an HCBS approved waiting for Medicaid provider approval?
Oh, so you're waiting for Medicaid. So if you're not approved yet, you will not have access to that. So you have to be approved first. But I just changed screens here, Sadiq. So if you want to go ahead and email me at that email address with your name and your agency information, I'll go into our report and I'll check it out and I'll see if you're in there. And if you are, I can help you get logged in. But just send me that information and we'll get you some help. And that goes for everyone else. If anyone is having any issues, they're encountering something with the website that's a little glitchy or not working, or load times are taking too long, they should take between 2 and 3 seconds to go from one screen to another. But if they're taking like 10 to 20, 20 to 40, send that to me, and we'll get a fix going.
John, I might have see if maybe Heather can speak to HB 251328, the implement recommendations of the Direct Care Worker Stabilization Board, and
Sure.
how DCC maybe ties into that. Would that be all right?
Yeah, that'd be great. If Heather's able.
Yeah, thank you. And I am going to drop the link to that bill in the chat. If you are aware already, great, you're ahead of the game. If not, here is a good awareness. House Bill 251328 is was aligned with a lot of the recommendations from the Direct Care Workforce Stabilization Board. And in that bill, they require the state to create a communication platform. Essentially, a lot of what the direct care careers already does, the job matching, supporting self-directed folks with CDOS and finding employers or employees, matching, being able to be matched towards folks with skill sets that you're looking for, like maybe it's a language you've spoke or a certain training that you require. So a lot of that stuff is already on the site. Um, One thing that the bill does talk about is that all providers have to make sure that their employees, their workers are aware of the site. And all workers get the opportunity to opt in or out of the site. So if they don't want to sign up for the site, they don't have to sign up for the site. They just need to be aware of it. And if they do want to sign up for the site, they can opt in on whether to have their information shared with other entities. Otherwise, if they're signed up at the site as a user, we provide information to the users. We don't provide the users information anywhere else. So that would be a very specific thing that they would opt in for. But just making, I wanted folks to know that this is a site that you're going to have to make sure workers are aware of. Along with a few other things. Another big one is the Know Your Rights training, which Colorado Department of Labor and Employment is working on. And so that training may be offered on the site. We haven't yet connected with them on the specifics of that, but it will probably be on the radar within the next year for a lot of folks working in the home and community-based system with Medicaid dollars. So we really would like folks to get familiar with it and see how it works for them and to provide feedback so we can always take that to the vendor. It's a challenging to have a system, an LMS for 30,000 workers, right? That is going to have some challenges. We don't know that all workers in the space will sign up for it. We do have, I believe, 1,500 individual users signed up. We tend to refer to them as workers. They're not necessarily workers. They could be like I myself am signed up for it. Or it could be a natural support signed up looking for resources. So we try to call them users, but just putting it out there with this bill, it's going to have more awareness, and we just want folks to know about it and get used to it now so that they're all ready to go by 2026 when it's a requirement.
Thank you, Heather. All right, John, we have a few more questions coming in. Shelley has a great
Great.
question.
Yeah.
Is this something that can be used for onboarding direct care staff?
So I would encourage you to go in there and check out the modules beforehand and make sure that it is right for you and your staff. With all the modules, especially in the Colorado Direct Care training, were developed using a universal care model or universal worker model. So they should be good for being able to onboard, and some of the tools will be useful for that, especially like things like the HIPAA training and a lot, some of that is just like standard onboarding. You got to do get your HIPAA certificate. So I would say yes, with the caveat saying that go ahead, go in there and check them out as well before you start assigning, so that you know what they are and that make sure that they do align with your onboarding that you have currently. And thanks, Sadiq. I just got your email, so I'll reply to that here in just a little bit after this meeting.
Perfect. Thanks, John. Another question around email. And Jody, if I miscapture this, please feel free to come off mute. But Jody says, we are an approved provider and I got an error. I've sent an email to the one on the screen provided, but not to you specifically. Should I also email you? So I think just maybe clarification on maybe help desk versus the one on the screen right now?
Yeah, for sure. So the help desk is where you want to go each and every time if you get an error. And if the help desk isn't able to help you, that's when they send that to me. But if you're not hearing from the help desk or you're not getting a response, go ahead and send that to me and I'll get with them and see what's going on. Part of that is like I don't have the capability to update people's passwords. So that's something that the vendor can only do. So, and we want to make sure that those are logged and are tracked through the vendor. And that's why we ask you to go through the help desk rather than straight to us the first time, because we want them to know that, you know, what the issue is and where it is before they get it to us. But yeah, I would say definitely if you just sent it and you haven't heard anything back, give it a little bit. But if it's been a day or two, feel free to send me an email at the email that's on the screen. And I think I just dropped that in the chat as well, that email.
Perfect. Let's go to Annette. She has her hand raised, and then Judy, I will get your question in the chat. Annette.
Sure.
Hi, everyone. I'm so sorry. My camera is not working this morning. Annette Daly from the Health Policy Office, and it's really awesome to see the improvements made to this LMS. It was already pretty cool to have here at the department for these workers. I have a question about if we have providers that are enrolled as providers but are not direct care workers, but non-licensed providers, could they create a profile to have access to some of the trainings like the HIPAA and some others that I think are really universal to Medicaid providers?
Yeah, for sure. If they're in there as an employer, they can still take all of like they can access the resources, they can access the LMS and the trainings and take those. If they are concerned and want to have, you know, their name on those certificates, then they would have to create a profile as a worker. I saw Heather pop up. Do you have anything to add to that, Heather? No? Okay. Does that answer your question on that?
Yes, thank you so much. I'd
Yeah.
love to like have something dedicated for this non-licensed provider, but we're, as Heather mentioned earlier, like, you know, money and resources and all these things, just trying to think, you know, outside of the box of what would be feasible right now.
Yeah, for sure.
Perfect. Thanks, Annette. Thanks, John. Judy asks in the chat, on the new LMS, how often will the users need to update their password?
65 days. Every 65 days, individuals will receive an email saying that their password is going to expire and that they need to reset that, and that is industry standard.
Thanks, John.
Yeah. Any other questions? All right. Well, if there are no other questions, we'll wrap this up. And please feel free, as I said, send me any questions, comments, resources, training ideas to our workforce email that's on the screen. And if you haven't already gotten into the direct care careers, please go check it out and it, yeah, enjoy, and I hope it is everything that you're looking for. But also look out for these new features that are coming, especially with the badges in the next few months. And we'll be working on some other additions as we continue. Thank you all.
Thanks, John.